Greetings of the day. So in this video we will be learning about the formation of the placenta, which is a very important question, and also the umbilical cord, and also a brief notes about the twinning phenomena. So first of all, that is the placenta formation. So or just the placenta and then the umbilical cord. So with which we will be marking the ending of the general embryology, and also it is a very important question, that is the formation of the placenta and the umbilical cord. Okay, so before going, just let me say you one line. In the previous video, we have learned about the extra embryonic membranes, and which also includes the allantois, yolk sac, what are all the subdivisions. Now, let us try to understand a brief about the implantation also. Okay, so which was touched in the last video also. Okay, so where we have seen the different types of the decidua, that is the decidua basalis, capsularis, and then the decidua parietalis. Okay, so with that information, now let us move into the formation of the placenta. So first of all, let us try to understand what is actually the placenta. So what is the definition? Okay, so definition of the placenta, it can be said as the, it is a feto-maternal organ. Okay, so it is a feto-maternal organ intended for the transport of the nutrients from the mother to the baby. So as it is, the name itself is suggesting, it is the feto-maternal organ. So that contains a fetal component and also the maternal component. So the fetal component, it is derived from the chorion frondosum. So which I will be drawing a diagram in a while. So that is the fetal component is derived from the chorion frondosum, and maternal component is derived from the decidua basalis. Okay, so which is an important MCQ. These are the fetal component of the placenta is derived from the chorion frondosum, and maternal component of the placenta is derived from the decidua basalis. Okay, so now once again the so these are the the sources from which they are derived from. Now coming to the structural components of the placenta. So coming to the structural components of the placenta, that is the fetal component consists of the amnion, extra embryonic mesoderm, chorion, and then the chorionic villi. So whereas the maternal component, that's what we have discussed, that is the decidua basalis, septate, and the blood vessels. Now, so first of all, let us try to understand the stages in the development of the placenta. So now stages in the development of the placenta. So first of all, let me make a note here. So first of all, that is the formation of the chorion frondosum, formation of the chorion frondosum and chorion leve. Okay, so chorion leve. Okay, and then after that one, the second stage will be named, will be learned under, or will be said under formation of the trabeculae, formation of the uh, trabeculae, and then the intervillous spaces, trabeculae, and then the intervillous spaces. So these are the stages under which, and the third one, that is the development of the chorionic villi. So that is the third stage, that is the development of the chorionic villi. And then the next one will be the, so development of the chorionic villi, and that is followed by the formation of the cytotrophoblastic shell. Okay, so that is the formation of the cytotrophoblastic shell. Cytotrophoblastic shell. Okay, so these are the stages under which we will be learning the formation of the placenta, and it will be easier for learning and also by describing in the examination. So these are the different stages. So now let us try to understand in a pictorial way. So first of all, that is the, as I have said, the first level will be formation of the chorionic frondosome or simply the chorion frondosome, and then the chorion leve. Okay, so when we try to understand, it's actually let us try to understand the cross section in a cross section. Okay, so and here this will be the, this will be the uterine cavity. So let me write it, that is the uterine cavity. And here we have seen in the previous video, that is the implanted embryo. So this is the chorion. Let us name this as a chorion. Okay, and deep to that one, that will be the embryo. And now what is happening is that the numerous chorionic villi, which are called as the finger-like projections, will be arising from all the directions of the developing embryo. So like this. So these are called as the finger-like projection, called as the chorionic villi. So let me label it here. So this is the chorionic villi. So now what happens is that the chorionic villi, which are developed from all the sides, what is happening is that some part of the chorionic villi will get degenerated. So we have to understand at which area it gets degenerated. So this is the region. So this is the region which gets degenerated. Why? Because that is facing towards the decidua capsularis. Okay, so as a result, this part of the chorion become smoother, and now that is called as the chorionic leve. So now let me show you in a different diagram here, sidewards. So the same picture here, the cross section, and here that is the which I am labeling in a short form, that is the uterine cavity as the UC, and then this is the developing embryo here, so with the chorion. And then now most importantly, so the point to be noted here is that only on one side the villi will be present, and the other side the villi will be absent. So the side towards the decidua capsularis, the villi will be absent, and now here we will call that region as the, at the smoother, the region which became smooth due to the degeneration of the villi, we will call that as the chorion chorion leve. Chorion leve. Okay, so that is the chorion leve. Where it is formed, it is facing towards the decidua capsularis, so which gets compressed and later degenerated. Now what is happening is that the other side which is there, that is not compressed, and that's why they won't degenerate also. Okay, and but the interesting point to be noted here is that this area, they grow extensively into the decidua basalis, and now that is called as the chorion frondosum. So that's what I have already said, we have already learned. So the part on which it is developing very much, that is called as the chorion frondosum. Okay, now after this one, what is happening is that now we will be going into the second level. So what is that second level is that formation of the trabeculae and then the intervillous spaces. Okay, so now what is happening is that now we will be learning at a still lower level, that is the, now that we will be going to the level of the cells of the trophoblast and what are they doing. Okay, so now the cells of the trophoblast, what they are doing is that, which are actually if you recollect them, the cells of the trophoblast are nothing but the single layer of the cuboidal cells, and what do they do is that they proliferate and they move on its surface. And now due to which what is happening is that here okay, so here they will be forming a two layers. So that is the one which have lose the cell membrane, that is called as the syncytial trophoblast, and that will be the superficial. You can remember S for S, superficially syncytial, deep it is the cytotrophoblast. Okay, so now let us try to understand in a diagram wise. So now what is happening is that the extra embryonic mesoderm, so here I will be drawing the layer by layer. So first of all, so that is the first layer. Okay, and on this is the extra, the gap between the two lines, it is the extra embryonic mesoderm. And now here for a differentiation I will change the color. Now that will be the, so with their nuclei. Okay, so now we will name them as the, so this is the cytotrophoblast. And above it what is happening is that, once again for differentiation, so above it what is happening is that, that is the layer which have lost its cell membrane, and that is why we will call this as the syncytiotrophoblast. So that is called as the syncytiotrophoblast. And here that is the cytotrophoblast. So syncytiotrophoblast and then the cytotrophoblast. And here it is called as the extra embryonic mesoderm. So extra embryonic mesoderm. So now, what in the further layer, what happens is that there will be happening, there will be formation of the some gaps in the syncytiotrophoblast. There will be the formation of the some gaps which are called as the lacunae. Okay, so you can say that the syncytiotrophoblast grows rapidly and erodes the deciduo basalis and becomes thick. And now here the small cavities which are termed as the lacunae, they will be appearing in the syncytiotrophoblast layer. Okay, so now let me show in the same diagrammatic, in the same diagrammatic. So this is the first stage. Now here below the number 2 I will be showing you the second, the next level. So the same first layer, that is the extra embryonic mesoderm. And here there will be the cytotrophoblast. Okay, so cytotrophoblast, and on which, we will be seeing the syncytiotrophoblast. Now here most importantly we will be seeing the formation of the lacunae. So you can be, it is clearly seen by the differentiation. Okay, so lacunae, and in between them that is called as the trabeculae. So now let us name one by one. So this is the lacunae. So in between them that is the trabeculae. And here this is the same cytotrophoblast. And in this is all the syncytiotrophoblast. So whatever all the phenomena which is happening, that is the syncytiotrophoblast. So that is the second level. Now now in the next level, the point to be noted is that now the syncytiotrophoblast will be further growing, and it erodes the blood vessels of the deciduo basalis. So now what is happening is that the blood will be entering into the lacunae, okay, along with the secretions of the endometrial glands. So now later the lacunae communicate with each other around the trabeculae, and they form the intervillous spaces. Okay, so now I will be drawing, here in the the further level, so which I will be numbering as the number 3 in the third level. So let us try to understand what are all happening. The same extra embryonic mesoderm, okay, and then on which will be sitting the cytotrophoblast. Okay, so cytotrophoblast, and here here that will be the upper layer. So between this one, this is the syncytiotrophoblast. Now here what is happening is that the lacunae will be there. Okay, so now in between them, that is the intervillous spaces have developed now. Okay, so in the intervillous spaces, what happens is that the blood vessels will get eroded and they will be entering into the lacunae. They will be entering into the lacunae. So here that is now here that is the, so here we can see. Okay, so now lacunae and the lacunae and these both, they are called as the primary villi. They are called as the primary villi. Actually, at this junction, let us try to understand what is actually a villus and how many types of villus are there and what is their composition. Okay, so just let us take a break in the placental formation. At this level, let us try to understand the different types of the villi. And before going further, let me stress what actually is the villi. So just going into the previous few moments back, what we have taught, from the surface of the trophoblast, what happens, that's all, from the surface of the chorion, which is including the trophoblast and extraembryonic mesoderm, the small finger like projection will be erased and they are only termed as the villi. Now these villi are of the different types. Okay, so and then the tertiary. So let us try to understand pictorially. So what are all the different types of the villi? So as I've said you, that is the first of all the primary villus. Primary villus. So in the primary villus, what is happening is that that's only the cytotrophoblast covered by the syncytiotrophoblast. So cytotrophoblast covered by syncytiotrophoblast. Okay. Now here, so let us try to understand the diagram. So as they are the finger-like projection. So first of all, the finger-like projection. So on which the cytotrophoblast. Okay, fine. After this one, that is the syncytiotrophoblast. So this is how the primary villi looks like. Okay, so the cytotrophoblast which is covered by the syncytiotrophoblast. So this is CYT and SYN, that is the syncytiotrophoblast. Now in the secondary villus, what is the main difference is that here what is happening is that the core of the mesoderm is also seen. So for our understanding, let me show you the color difference. So first of all, this is the core of the mesoderm. Okay, and on which there will be the cytotrophoblast, and the gap between further, that is the syncytiotrophoblast. Okay, so the same once again. Okay. So now here what is happening is that the red color one, that is called as the extra embryonic mesoderm. So this is one difference we will be seeing in the secondary villi. So this is the extra embryonic mesoderm which is covered by the cytotrophoblast and which is on which we will be seeing the syncytiotrophoblast. So this is called as the secondary villus. This is called as the secondary villus. Now comes the tertiary, or also called as the definitive villus. Okay, so now we will call it as the tertiary, or also called as the definitive villus. Tertiary, also called as the definitive villus. So now what is the difference is that we will be having the fetal capillaries. Okay, so the fetal capillaries appearing in the mesodermal core, which is covered by the same mesoderm, followed by the cytotrophoblast, and followed by the syncytiotrophoblast. Okay, so now we will be coming from above. So this is the syncytiotrophoblast, and over which we will be having the cytotrophoblast. Okay, so when I'm saying the cytotrophoblast, that should be drawn by the cells. Okay, so now after this one, that is the extra embryonic mesoderm, the red color layer, the third one. And now in which what will be seen is that there will be an artery here. Okay, so there will be an artery here, and there will be a vein. There will be a vein. So now if you try to understand, this is how the primary, secondary and tertiary villus, which is also called as the definitive villus, will be looking like. Okay, so primary, which is only just a finger like projection, which is having the cytotrophoblast covered by the syncytiotrophoblast. Secondary, where we will be having the extra embryonic mesoderm, and then in the tertiary villi we will be having the blood vessels. Now after this one, what is happening is that the fourth level will be has to be understood, that is called as the formation of the cytotrophoblastic shell. Okay, so formation of the cytotrophoblastic shell, that is the fourth level. Okay, so now what is happening is that the cells of the cytotrophoblast in the apical region of each villus. Okay, so they will be proliferating, piercing, and they will be passing across the layer of the syncytiotrophoblast, which is called as the cytotrophoblastic shell. And this cytotrophoblastic shell, instead it is attached to the decidua basalis. Okay, so now what is happening is that due to which we are having the division of the cytotrophoblastic shell. So now let me try it, let me show in the picture. Okay, so the same once again here, the first layer. Okay, so now from where we have gone, we have seen the villus. Okay, so now here at this point, at this junction, let us try to understand the the branches of the villi also. Till now what we have learned is that each villi is the finger like projection arising from the trophoblast, and then that will be, that are of three types: primary, secondary and then the tertiary. Now in the primary, secondary, tertiary, what is happening? So they are the differences just before we have learned. Now what is happening is that the villi, they are getting branched now. Okay, so this is the, now let us try to understand. So let us assume this is the trunk, so that is why we will call it as the truncus corae. Okay, so which is also called, you can term it as the stem. Okay, fine. Now from the stem, main stem, so we will be seeing the branches. Okay, so these branches, these are the branches. So these are the branches. So now when these are the branches, we will call them with the scientific name, that is the ramus corae. Okay, so we will call it as the ramus corae. And still further, once again, so this one ramus corae will be once again undergoing the branches, which are called as the, as they are further branching, we will call them as the ramuli corae. They are called as the ramuli corae. Okay, so truncus corae, ramus corae, and lastly that is the ramuli corae. And what is happening is that on which the cytotrophoblastic shell will be forming. So for the color differentiation, let me show here. So this is the cytotrophoblastic shell. Okay. So now this is how the anchoring villi will be seen between the layers. Okay. So now first of all that is the truncus corae, and which further divide, that is the ramus corae, and lastly if they further once again they divide, they are called as the ramuli corae, on which the you will be seeing the cytotrophoblastic shell. Okay. So now after this one, so whatever we have learned, that is all actually the functional and structural components of the placenta. But now when we get a chance to see the placenta with our naked eye, what is happening is that there will be the formation of the uh, there will be formation of the we can see what they are called as a cotyledons. Okay, so numerous subdivision sort of thing can be observed, so that are called as the cotyledons, which is also learned under the lobulation of the placenta. Okay, so which is termed as the lobulation of the placenta. So in this picture only, let me try to explain here. So the lobulation of the placenta, let us try to understand. Now what is happening is that after the formation of the placenta, what is happening is that the cytotrophoblastic shell and anchoring villi, what do they do is that numerous septa they grow inwards. Okay, so the numerous septa they will be growing inwards and dividing the maternal surface into the 15 to 20 irregular cotyledons. Okay, so this is the reason why on the maternal surface when we see, they will be observing of the observation of the lobulation, which are called as the cotyledons. Now what I will, so I will label this as the one cotyledon. So first one, so second cotyledon, third cotyledon, and this is the fourth cotyledon. Okay, so as such these are the different these is so usually 15 to 20 cotyledons will be observed placenta into the sorry on the placenta maternal surface, we will be observing the 15 to 20 cotyledons. Now what is happening in the each cotyledon? Okay, so let us discuss about each cotyledon. So they will be containing 2 to 3 anchoring villi. Okay, and then the as the pregnancy is proceeding, the placenta also enlarges. Okay, so now this is the how the placenta is formed. So after understanding the formation, by learning about the functional units that are the villi, now let us try to have a small brief note about the features of the placenta. Okay, so the features of the placenta, that is the flat circular disc, the features that is the flat circular disc. Okay, so 15 to 20 centimeters diameter, so 15 to 20 centimeters is the diameter, and thick in the center about 2 to 5 centimeters thick, so particularly at the center, not at the periphery, which is variable. Okay, so now the weight will be around 500 to 600 grams, which will be very less in anemia and which will be very more in the gestational diabetes mellitus. Okay, so with this the placenta formation is done, and now there is a very important 3 marks question that is called as the placental membrane. So what are all the contents of the placental membrane? Let us try to understand. After that, which is followed by the functions of the placenta, and then congenital anomalies of the placenta. So now let us try to understand the placental membrane. So which is an important 3 marks question. So that is the placental membrane. So this placental membrane, so what is it doing? The basic function is that separating the maternal blood from the fetal blood. So what does it do is that it separates the maternal blood from the fetal blood. Separates the maternal and also the fetal blood. Okay, so now what is happening is that due to which there will be no mixing. Okay, so now let us try to understand the placental membrane or the placental barrier. So usually in questions it is called as the placental membrane only. So let us try to understand in the pictorial way. Okay, so first of all, so this is the layer, and on which they will be seeing the cytotrophoblast. Okay, so this is the cytotrophoblast, and now when I say the cytotrophoblast, obviously it will be surrounded by the syncytiotrophoblast. Sorry. So sorry for the small technical glitch here. Okay, so let us try to understand the. This is the cytotrophoblast. Okay, so now that is followed by the syncytiotrophoblast. Okay, so that is the syncytiotrophoblast, and now into the deep one we will be seeing the once again, so with a different color, let me show that here. This is the fetal capillary. So now what I have been drawing, that will be the fetal capillaries. Okay, so now let us try to understand here. Now this is in the early stages of the pregnancy. So first of all, one by one, let us try to label it. So the gap, that is the syncytio first of all, syncytio and next one, that is the cytotrophoblast. So this is the cytotrophoblast, and here this is the fetal capillary. Fetal capillary, and then after this one, this is the next one. This is the basement layer of the cytotrophoblast layer. So this is the basement layer of the cytotrophoblast. Basement layer of the cytotrophoblast, and here this is the extra embryonic mesoderm. So extra embryonic mesoderm, and here this is the endothelium. So here we will be calling it as the endothelium. Endothelium. So now here what is this is these are all the components of the thick placental membrane. So now just I will be showing with it. So this is the thick placental membrane. These are all the components of the thick placental membrane. So the same in the early stage. So now as the pregnancy is progressing, what is happening is that in the late pregnancy, the thin cytotrophoblast and then the endothelial layer will be there. So this is about the layers of the uh, placental membrane. So now that is why, so as there is a membrane separating, the maternal blood is separated from the fetal blood by the chorionic tissue. So that is why the human placenta, okay, so that is why the human placenta, it is termed as the hemochorial. So the human placenta is termed as the hemochorial structure. Okay. So now which will be followed by the different anomalies of, sorry, before going into the anomalies, let us try to understand the functions of the placenta. So functions of the placenta. So when usually the formation of the placenta is asked, so these are also to be mentioned. Functions of the placenta. So in the functions of the placenta, the first important point, that is the exchange of the gases. The first point, that is the exchange of the gases. So involves of the supply of O2 from the maternal blood to the fetal blood. And next one, that is the transport of the nutrients. Okay, so that is the transport of the nutrients, and then excretion of the waste, excretion of the waste products, and next one, that is the transmission of the maternal antibodies. So now in the transmission of the antibodies, what we will be learning is that the maternal antibodies, that is the IgG, alpha globulins, and then the immunoglobulins can cross the placental barrier. Okay, so and then the next one will be the barrier function. Okay, so that is the barrier function. Okay, so now what is happening is it acts as the barrier to many bacteria and then the organisms. So some of these are toxins to man, they will be crossing the barrier and they may cause the fetal defects such as the rubella, syphilis, and also the maternal hormones or cannot cross the barrier, the maternal hormones like ACTH and then the TSH, and also most importantly the production of the hormones. Okay, so the production of the hormones, production of the hormones. So what are they? That is the progesterone, which maintains the pregnancy, and next one, the placental estrogen, which promotes the uterine growth and also the mammary gland growth, and then the HCG, human chorionic gonadotropin. Okay, so to maintain the corpus luteum, and then the somatomamotropin and also the relaxin, so which causes the uterine ligaments or pelvic ligaments and widens the cervix to facilitate the parturition, and then the storage function, so the glycogen, calcium, and iron in the early months of the pregnancy. Okay, so these are all the functions of the placenta. Now most importantly, very commonly asked question, that is the anomalies of the placenta. Anomalies of the placenta. Congenital anomalies of the placenta. Congenital anomalies of the placenta, they are grouped into three types actually. So for our understanding, let us have an easy way of learning, that is the congenital anomalies, they are classified into three types. So due to the abnormal adherence, so one type is due to the abnormal adherence of the chorionic villi to the uterus. So second one, that is the abnormal shape, abnormal shape, and the third one, abnormal site of attachment. So abnormal site of UC attachment. So that is the umbilical cord attachment. Now let us come back to the first type. So the first type, that is the adherence of the chorionic villi. So now that is the first one, that is the placenta accreta. So placenta accreta. So what is happening is that if the chorionic villi are attached to the endometrium, chorionic villi are attached to the uterine endometrium. So next one, that is the placenta increta. So placenta increta. So what is happening here is that penetrates the myometrium, penetrates the full thickness of the myometrium. And next one, that is the placenta percreta. Sorry, placenta percreta. So this placenta percreta, what is happening is that the full thickness of the, so penetrates the full thickness of myometrium, and then the myometrium and perimetrium. Myometrium and then the perimetrium. So let me show this in the simple pictorial way. So this is the uterus. Okay, so now here, in which there is a layer. Okay, so now the first of all, that is let me show with a different color. So that is the first of all, that is the placenta accreta. So they are attached to the endometrium. They are attached to the endometrium. So here, this is the placenta accreta. So this is, I will number it as the 1, placenta accreta. Now the second one, that is the placenta increta. So what does it do is that it goes inside. Okay, so this I will number it as the 2, that is the placenta increta. And the lastly third one, that is the placenta accreta. It completely, it goes inside. Okay, full thickness of the myometrium and even the perimetrium, that is called as the placenta percreta. So this is the first of all, due to the abnormal adherence. Now next one, that is the abnormal shape. Okay, so now this is the, now the next one, that is the abnormal shape. So now this is the abnormal shape. So the anomaly is due to the abnormal shape. So now let us try to have in the pictorial way. So first of all, that is the bilobed or the bidiscoidal placenta. So bilobed or the bidiscoidal placenta. So this is the bilobed or the bidiscoidal. So we will name this is the bilobed or the bidiscoidal placenta. Bidiscoidal placenta due to the two lobes. So now the second one, that is the multilobular. So now the second one, that is the multilobular. So this is the multilobular, so more than two lobes. And now there is a third type, the next type, that is the diffuse. Okay, so diffuse, there is no a fixed shape as such. Okay, the thin and not disc shaped. So all around the blastocyst, if the chorionic villi persists, then the diffuse placenta will be seen. Okay, so this one. So there will be no any definite shape as such. So this is the diffuse placenta. So this classification is according to the shape. Now there is the commonly asked 3 marks or in the MCQs, that is the placenta succenturata. So what is happening is that first of all a normal placenta will be there. Okay, in which what is happening is that a small part of the placenta will be getting separated. Okay, a small part of the placenta will be getting separated. So this is the normal placenta, and here there is a small part that is called as the placenta succenturata, SUCC. So this is the placenta succenturata. And now the fourth one, there is the fourth one, the fourth type, that is the placenta which is the fenestrata. So what is happening is that here there will be a hole. Okay, so here there will be a hole which is actually a normal placenta. So but what happens is that there will be a hole at one side. Okay, so this is the placenta fenestrata. So this is the placenta fenestrata. And now lastly, that is the circumvallate placenta. So here what is happening is that the peripheral edge of the placenta is covered by the residual fold actually. Okay, so now here as usually, so here you can see, we can observe, this is the placenta. So now, so this is the placenta. Now what is happening is that with a different color, so I will show that. So there is the fold of the circular fold of the decidua. So this is the circular fold of the decidua, so which is called as the peripheral edge of the placenta is covered by the fold of the decidua. So this one and this one, that is the fold of the decidua, fold of decidua. And here this is the placenta. So here these classification is according to the abnormal shape. So bilobed, multilobular, diffuse, placenta succenturata, placenta fenestrata. So here this is the whole, so that is why it is called, there is a fenestration, so that is why placenta fenestrata. And lastly circumvallate placenta. So this is about the anomalies due to the abnormal shape. Now next coming to the anomalies due to the abnormal site of the attachment. Okay, so the same lies, let us understand by with the diagrams. So that is the abnormal according to the anomalies of the placenta according to the abnormal attachment of the umbilical cord. Abnormal attachment of the umbilical cord. Okay. So now let us try to understand. So that is the normal or the paracentral is usually a regular one, regular attachment. Okay. So here that is the normal. So normal placenta with an central attachment. Okay. So with a just a moment. Okay, so this is the central attachment. Okay, so this is the central. Now what is happening is that a slightly a side attachment will be there. So this is the paracentral, which both are considered as the normal only, normal attachments. Okay, so now comes the abnormal attachments one by one. Okay, so first of all, this is the placenta, and here there will be the marginal attachment. Okay, so there will be the marginal attachment of the umbilical cord. Okay, so here we will call it as the marginal attachment, also called as battledore placenta, also called as the battledore placenta. And now the next one, that is the furcate. Okay, so the next type of the abnormal attachment of the placenta, it is called as the furcate. So in the furcate, what is happening is that they will be dividing before entering the placenta. So we will name it as the furcate. And lastly, that is the velamentous placenta. Okay, so when the umbilical cord is attached to chorioamniotic blood vessels to proceed and and ramify there before reaching the placenta. So now the fourth one, so that is the fourth one, we will be seeing the uh, velamentous placenta. Okay, so here this is the fetus, the same. And now coming to the umbilical cord. Okay, so they will be going here, and before entering only they will be going surround circular. So this is called as the velamentous placenta. So here in the velamentous, what is happening is that chorioamniotic blood vessels only, they will be chorioamniotic blood vessels to proceed unprotected and ramify there before reaching the placenta. Okay, so now let us try to learn about umbilical cord briefly, and end the video. Okay, so now the coming to the umbilical cord. So now we will try to understand very brief, within 4 5 minutes. Let us end. So that is the umbilical cord. So its usually length is about 50 to 55 centimeters. Okay, and it is the length 50 to 55 centimeters is the length, and 1 to 2 centimeters is the breadth. 1 to 2 centimeters is the breadth. So these are the measurements at full term. These are the measurements at full term. So what is happening is that this is a twisted cord like structure. So umbilical cord, we will say it is the a twisted cord like structure. Twisted cord like structure, so by which fetus is attached to the mother. Okay, so fine. After this one, they present some false knots. And now how it is developed from. Okay, so it is developed from the connecting stock. So in one of the previous videos, we have learned about the formation of the connecting stock. Okay, so connecting stock, and from there the umbilical cord is developed, and further during the further development it becomes narrower and moves to the caudal end of the embryo. Okay, so that is how it happens. And now the umbilical vessels, they will be developing. So the umbilical vessels, they will be developing in the third week. So umbilical vessels, they develop in the third week of the development. And the and also we will be seeing the blood vessels in them surrounded by the structure called as the Wharton's jelly, which is an important point. So Wharton's jelly, which is an example of the mucoid connective tissue, commonly asked MCQ. So mucoid connective tissue. So mucoid connective tissue. So what is happening is that it obliterates as the amniotic cavity, so it as it develops. Okay, and just it forms a tubular slit. So the Wharton's jelly actually protects the umbilical cord. So now coming to the contents, let us try to learn directly in the pictorial way. So this is the cross section. So the upper layer, that is from the amnion, that is from the amnion. Okay, and in which we will be seeing the, first of all, that is the umbilical vein. Okay, and then here we will be seeing the two umbilical arteries, so which with a different color. Okay, so that is the umbilical arteries. And so here, so let us label. So the upper one, that is the umbilical vein, umbilical vein, and these are the two umbilical arteries. These are the two umbilical arteries. Okay, so the, that is the amnion, and in which now the surrounding will be the Wharton's jelly. Wharton's jelly. Apart from this one, there will be the remaining of the allantois diverticulum and remaining of the vital lobe intestinal duct. So here we will label it as the allantois remnant, remnant, and here we will be seeing this is the vital lobe intestinal duct remnants. Vital intestinal duct. So now what they will be doing is that, so the umbilical arteries carry the deoxygenated blood, so that's why I have shown with the blue color, and the uh, umbilical arteries, they carry the deoxygenated blood, and the umbilical vein carries the oxygenated blood. Okay, so now already we have learned about the attachments of the umbilical cord to the placenta under the anomalies. So coming to the uh, complications. Okay, so sometimes if the cord is long, what is happening is that it is likely to prolapse through the uterus during the parturition, and that rise to a condition called as the cord prolapse. So it will be getting compressed between the fetal head and the pelvic wall, and this may lead to the hypoxia. Okay, so and then coiling of the cord in about one fifth of the deliveries we will be observing. So it sometimes encircles the neck of the fetus and may cause the strangulation also. So short cord and premature separation. A short cord may create difficulty. And lastly, the velamentous umbilical cord, that is the insertion. It is different actually in umbilical cord. Sorry, the umbilical vessels are inserted into the chorioamnionic membrane. So with this, let me end the video. So as it is becoming longer, I'm skipping the twinning topic to the next video. Thank you.